Welcome to The Explainer. Today we're unpacking a super practical guide from radiographer Rad Kelvin Lunsey. So, if you've got an X-ray appointment coming up, or, maybe you just want a better peek behind the curtain of the medical imaging process, you are in the exact right place. We're going to walk step by step through 5 crucial things every single patient should know before they ever step foot in that imaging room.
But hey, let's be honest for a second. When a doctor tells you that you need an X-ray, it is completely normal to feel this sudden wave of nerves. It's the fear of the unknown, the intimidating look of those giant machines, the whole clinical vibe. It's a totally universal feeling. If you've ever felt that sudden pit in your stomach when you're handed a referral, trust me, you are absolutely not alone.
But here's the really good news. You don't have to stay in the dark, and you definitely don't have to stay anxious. Grasping just a few simple facts can completely transform your appointment. We've got insider knowledge straight from a pro to demystify the whole process for you. This explainer is all about giving you the tools to make your experience not just way easier, but a whole lot safer too.
Section 1. Preparing for your scan.
Okay, let's dive into this. The prep work actually starts before you even leave your house. Setting yourself up at home really sets the stage for the clinic. So, tip number 1 from Rad Kelvin is all about your wardrobe. You definitely want to arrive in comfortable clothing, sure, but more importantly, you got to be super mindful of metal. You should either leave it at home or be completely ready to take off stuff like jewelry, belts, watches, and clothes with metal zippers or snaps. Why is this such a big deal? Well, metal literally blocks X-rays, which messes up the final image quality. Keep it simple and keep it metal-free.
Moving right along to tip number 2. And please, pay close attention because this is an absolutely critical safety step. Step 1. You are pregnant. Or hey, even think there is a chance you might be. Step 2. Tell your radiographer immediately. This clear communication needs to happen before you even get near a powered-up machine. It is a 100% non-negotiable part of the pre-scan process.
And here's exactly why speaking up is so vital. By giving your healthcare team the heads up about a potential pregnancy, you're handing them the power to choose the absolute safest imaging approach for both you and your baby. The medical team has these really careful, strict protocols ready to go for this exact scenario, but they can only use them if you keep them in the loop. It's entirely about prioritizing safety above all else.
Section 2. Inside the X-ray room.
And this brilliantly illustrates the next phase. We're fully prepped, so let's mentally step through those clinic doors. The golden rule of radiology is actually incredibly simple. Stand completely still equals the best possible image. On the flip side, movement causes a blurred image, which almost always means having to get another X-ray. And nobody wants to deal with the dreaded retake, right? So, holding your pose like a statue for those few short seconds is a total game changer to get it right the first time.
Now, to help you stay perfectly still, you're going to hear instructions just like this. Tip number 4 is to listen up and follow the radiographer's directions carefully. When they tell you over the intercom to take a deep breath or hold your breath, they are not just making small talk. Those precise little instructions actually stop the natural rising and falling of your chest and lungs. Freezing that internal movement is the real secret to capturing the absolute best, clearest possible image.
Section 3. Your voice matters. Now, what's really interesting about this slide is that it reminds us of our own role. In a clinical setting, it's so easy to feel like you're just a subject on a table, but you're actually an active, empowered participant in your own healthcare. You should never be afraid to speak up. It really helps to remember the goals of the professionals standing next to you. They want to make sure your exam is safe, comfortable, and accurate. The radiographer isn't just a silent machine operator. They're essentially your advocate in that room. So if you're uncomfortable or you're just kind of confused about what's happening, ask questions. They genuinely want to help you out and put your mind at ease.
Section 4. The informed patient.
This leads us perfectly into the big picture theme of this entire journey. It's worth taking a step back to remind ourselves why all this prep, the careful stillness, and the open communication actually matters. Medical imaging plays an incredibly important role in modern medicine. By doing your part to help capture a clear X-ray, you're directly helping your doctors diagnose illnesses early and accurately. A great image basically paves the straightest possible path for better, faster healthcare decisions.
So, the crucial point is perfectly captured right here. An informed patient is a safer patient. That is literally the core thesis of everything we've explored today. When you know exactly what to wear, when to mention a pregnancy, why you're holding your breath, and that you have every right to ask questions, you aren't just making the radiographer's job easier, you are actively protecting your own health and ensuring the safest possible outcome for yourself.
We're going to wrap up this explainer with a direct question posed by Rad, Kelvin Lunsey himself. Before today, how many of these 5 tips did you already know? It's a pretty fantastic question to chew on. Maybe you knew to ditch the watch, but you hadn't really thought about the mechanics of holding your breath. Take a second to think about this newfound knowledge. Let it empower you and carry it with absolute confidence to your next medical appointment. Thanks for hanging out with me for today's explainer, and as always, keep learning.